Chapter 56, Acute Intracranial Problems. Question: Family members of a patient who has a traumatic brain injury asks the nurse about the purpose of the ventriculostomy system being used for intracranial pressure monitoring. Which response by the nurse is best? Answer is, the monitoring system helps show whether blood flow to the brain is adequate. Short and simple explanations should be given initially to patients and family members. The other explanations are either too complicated to be easily understood or may increase the family member's anxiety. Next, admission vital signs for a brain injured patient are blood pressure 128/68, pulse 110, and respirations 26. Which set of vital signs, if taken 1 hour after admission, will be of most concern to the nurse? Answer is blood pressure 154/68, pulse 56, respirations 12. Systolic hypertension with widening pulse pressure, bradycardia, and respiratory changes represent the Cushing's triad. These findings indicate that the intracranial pressure has increased and brain herniation may be imminent unless immediate action is taken to reduce ICP. The other vital signs may indicate the need for changes in treatment, but they are not indicative of an immediately life-threatening process. Next, when a brain-injured patient responds to nail bed pressure with internal rotation, adduction, and flexion of the arms, the nurse reports the response as answer is decorticate posturing. Internal rotation, adduction, and flexion of the arms in an unconscious patient is documented as decorticate posturing. Extension of the arms and legs is decebrate posturing. Because the flexion is generalized, it does not indicate localization of pain or flexion withdrawal. Next, the nurse has administered prescribed IV mannitol to an unconscious patient. Which parameter should the nurse monitor to determine the medication's effectiveness? Answer is intracranial pressure. Mannitol is an osmotic diuretic and will reduce cerebral edema and intracranial pressure. It may initially reduce hematocrit and increase blood pressure, but these are not the best parameters for evaluation of the effectiveness of the drug. Oxygen saturation will not directly improve as a result of mannitol administration. Next, a 46-year-old patient with a head injury opens the eyes to verbal stimulation, curses when stimulated, and does not respond to a verbal command to move but attempts to push away a painful stimulus. The nurse records the patient's Glasgow Coma Scale score as an 11. The patient has a score of 3 for eye opening, 3 for best verbal response, and 5 for best motor response. Next, an unconscious 39-year-old male patient is admitted to the emergency department with a head injury. The patient's spouse and teenage children stay at the patient's side and ask many questions about the treatment being given. What action is best for the nurse to take? The answer is allow the family to stay with the patient and briefly explain all procedures to them. The need for information about the diagnosis and care is very high in family members of acutely ill patients. The nurse should allow the family to observe care and explain the procedures unless they interfere with emergent care needs. A pastor or counseling service can offer some support, but research supports information as being more effective. Asking the family to stay in the waiting room will increase their anxiety. Next, a 41-year-old patient who is unconscious has a nursing diagnosis of ineffective cerebral tissue perfusion related to cerebral tissue swelling. Which nursing intervention will be included in the plan of care? Answer is keep the head of the bed elevated to 30 degrees. The patient with increased intracranial pressure should be maintained in the head up position to help reduce ICP. Extreme flexion of the hips and knees increases abdominal pressure, which increases ICP. Because the stimulation associated with nursing interventions increases ICP, clustering interventions will progressively elevate ICP. Coughing increases intrathoracic pressure and ICP. Next, a 20-year-old male patient is admitted with a head injury after a collision with while playing football. After noting that the patient has developed clear nasal drainage, which action should the nurse take? Answer is check the drainage for glucose content. Clear nasal drainage in a patient with a head injury suggests a dural tear and cerebrospinal fluid leakage. If the drainage is CSF, it will test positive for glucose. Fluid leaking from the nose will have normal nasal flora, so cultural and sensitivity will not be useful. Blowing the nose is avoided to prevent CSF leakage. Next question. Which action will the emergency department nurse anticipate for a patient diagnosed with a concussion who did not lose consciousness? The answer is provide discharge instructions about monitoring neurologic status. A patient with a minor head trauma is usually discharged with instructions about neurologic monitoring and the need to return if neurologic status deteriorates. MRI, hospital admission, or surgery are not usually indicated in a patient with concussion. Next, a 23-year-old patient who is suspected of having an epidural hematoma is admitted to the emergency department. Which action will the nurse plan to take? The answer is prepare the patient for a craniotomy. The principal treatment for epidural hematoma is rapid surgery to remove the hematoma and prevent herniation. If intracranial pressure is elevated after surgery, furosemide or high-dose barbiturate therapy may be needed, but these will not be of benefit unless the hematoma is removed. Minimal blood loss occurs with head injuries and transfusion is usually not necessary. Next, the nurse is admitting a patient with a basal skull fracture. The nurse notes ecchymosis around both eyes and clear drainage from the patient's nose. Which admission order should the nurse question? Answer is insert nasogastric tube to low suction. Rhinorrhea may indicate a dural tear with cerebrospinal fluid leakage. Insertion of a nasogastric tube will increase the risk for infections such as meningitis. Turning the patient, elevating the head, and applying cold packs are appropriate orders. Next, a college athlete is seen in the clinic 6 weeks after a concussion. Which assessment information will the nurse collect to determine whether a patient is developing post-concussion syndrome? Answer is short-term memory. A decrease in short-term memory is one indication of post-concussion syndrome. Other data may be assessed but are not indications of post-concussion syndrome. Next, the nurse admitting a patient who has a right frontal lobe tumor would expect the patient may have an impaired judgment. The frontal lobe controls intellectual activities such as judgment. Speech is controlled in the parietal lobe. Weakness and hemiplegia occur in the contralateral side from the tumor. Swallowing is controlled by the brainstem. Next, which statement by a 40-year-old patient who is being discharged from the emergency department after a concussion indicates a need for intervention by the nurse? The answer is, I'm going to drive home and go to bed. Following a head injury, the patient should avoid driving and operating heavy machinery. Retrograde amnesia is common after a concussion. The patient can take acetaminophen for headache and should return if symptoms of increased intracranial pressure such as dizziness or nausea occur. Next, after having a craniotomy and left anterior fossa incision, a 64-year-old patient has a nursing diagnosis of impaired physical mobility related to decreased level of consciousness and weakness. An appropriate nursing intervention is to perform range of motion exercises every 24 hours. Range of motion exercises will help prevent the complications of immobility. Patients with anterior craniotomies are positioned with the head elevated. The patient with a craniectomy should not be turned into the operative side. When the patient is weak, clustering nursing activities may lead to more fatigue and weakness. Next, a 42-year-old patient who has bacterial meningitis is disoriented and anxious. Which nursing actions will be included in the plan of care? The answer is encourage family members to remain at the bedside. Patients with meningitis and disorientation will be calmed by the presence of someone familiar at the bedside. Restraints should be avoided because they increase agitation and anxiety. The patient requires frequent assessment for complications. The use of touch and soothing voice will decrease anxiety for most patients. The patient will have photophobia, so the light should be dim. The public health nurse is planning a program to decrease the incidence of meningitis in adults and young adults. Which action is most important? Answer is immunize adolescents and college freshmen against Neisseria meningitidis. The Neisseria meningitidis vaccination is recommended for children ages 11 and 12, unvaccinated teens entering high school, and college freshmen. Hand washing may help decrease the spread of bacteria, but is not as effective as immunization. Vaccination with Haemophilus influenzae is for infants and toddlers. Because adolescents and young adults are in school or the workplace, avoiding crowds is not realistic. Next, a patient has been admitted with meningococcal meningitis. Which observation by the nurse requires action? The answer is unlicensed assistive personnel enter the patient's room without a mask. Meningococcal meningitis is spread by respiratory secretions, so it is important to maintain respiratory isolation as well as standard precautions. Because the patient may be confused and weak, bed rails should be elevated at both the foot and head of the bed. Low light levels in the room decrease pain caused by photophobia. Nutrition is an important aspect of care in a patient with meningitis. Next, when assessing a 53-year-old patient with bacterial meningitis, the nurse obtains the following data, which findings should be reported immediately to the healthcare provider. Answer is the patient's blood pressure is 88/42 millimeters of mercury. Shock is a serious complication of meningitis, and the patient's low blood pressure indicates the need for interventions such as fluid or vasopressors. Natural nuchal rigidity and a positive Kernig sign are expected with bacterial meningitis. The nurse should intervene to lower the temperature, but this is not as life-threatening as a hypertension. Next, a patient admitted with a diffuse axonal injury has a systemic blood pressure of 106/52 and an intracranial pressure of 14 millimeters of mercury. Which action should a nurse take first? Answer is report the blood pressure and ICP to the healthcare provider. Calculate the cerebral perfusion pressure is CPP equals mean arterial pressure. Mean arterial pressure equals DBP plus 1/3 of the systolic blood pressure. Therefore, MAP is 70 and the CPP is 56, which is below the normal of 60 to 100 and approaching the level of ischemia and neuronal death. Immediate changes in the patient's therapy, such as fluid infusion or vasopressor administration, are needed to improve the cerebral perfusion pressure. Adjustments in the head elevation should only be done after consulting with the healthcare provider. Continued monitoring and documentation will also be done, but they are not the first actions that the nurse should take. Next, after an endotracheal suctioning, the nurse notes that the intracranial pressure for a patient with a traumatic head injury has increased from 14 to 17 millimeters of mercury. Which action should the nurse take first? Answer is ensure that the patient's neck is in neutral position. Because suctioning will cause a transient increase in intracranial pressure, the nurse should initially check for other factors that might be contributing to the increase and observe the patient for a few minutes. Documentation is needed, but this is not the first action. There is no need to notify the healthcare provider about this expected reaction to suctioning. Propofol is used to control patient anxiety or agitation. There is no indication that anxiety has contributed to the increase in intracranial pressure. Next, which patient is most appropriate for the intensive care unit charge nurse to assign to a registered nurse who has floated from the medical unit? The answer is a 45-year-old receiving IV antibiotics for meningococcal meningitis. An RN who works in the medical unit will be familiar with administration of IV antibiotics and with meningitis. The post-craniotomy patient with ICP monitor and the patient of ventricular should be assigned to RN familiar with the care of critically ill patients. Next, a male patient who has possible cerebral edema has a serum sodium level of 116 milliequivalents and a decreasing level of consciousness. He is now complaining of a headache. Which prescribed interventions should the nurse implement first? The answer is administer IV 5% hypertonic solution saline. The patient's low sodium indicates that hyponatremia may be causing the cerebral edema. The nurse's first action should be to correct the low sodium level. Acetaminophen will have minimal effect on the headache because it is caused by cerebral edema and increased intracranial pressure. Drawing ABGs and obtaining a CT scan may provide some useful information, but the low sodium level may lead to seizures unless it addressed quickly. Next. After the emergency department nurse has received a status report on the following patients who have been admitted with head injuries, which patient should the nurse assess first? The answer is a 50-year-old patient whose right pupil is 10 millimeters and unresponsive to light. The dilated and unresponsive pupil may indicate an intracerebral hemorrhage and increased intracranial pressure. The other patients are not at immediate risks for complication, such as the herniation. Next, the nurse is caring for a patient who was admitted the previous day with a basilar skull fracture after monitor vehicle crashes. Which assessment finding is most important to report to the healthcare provider? The answer is a temperature of 101.4. Patients who have basilar skull fractures are at risk for meningitis, so the elevated temperature should be reported to the healthcare provider. The other nursings are typical of a nature, but are typical of a patient with basilar skull fracture. After evacuation of an epidural hematoma, a patient's intracranial pressure is being monitored with an intraventricular catheter, which information obtained by the nurse is most important to communicate to the healthcare provider. The answer is temperature of 101.6. Infection is a serious consideration with ICP monitoring, especially with intraventricular catheters. The temperature indicates the need for antibiotics or removal of the monitor. The ICP, arterial pressure, and apical pulses are all borderline high, but require only ongoing monitoring at this time. Next question. The charge nurse observes an experienced staff nurse caring for a patient who has had a tracheotomy for resection of a brain. Which action by the inexperienced nurse requires the charge nurse to intervene? The answer is the staff nurse suctions the patient routinely every 2 hours. Suctioning increases intracranial pressure and should only be done when the patient's respiratory condition indicates it is needed. Next, a 60-year-old male patient is brought to the emergency department by ambulance after being found unconscious on the bathroom floor by the spouse. Which action will the nurse take first? The answer is check oxygen saturation. Airway patency and breathing are the most common vital functions and should be assessed first. The neurologic assessments should be accomplished next and additional assessment after that. Next, the patient has increased intracranial pressure and a ventriculostomy after a head injury. Which action can the nurse delegate to an unlicensed assistant personnel who regularly work in the intensive care unit? Answer is check capillary blood glucose level every 6 hours. Experienced UAP can obtain capillary blood glucose levels when they have been trained and evaluated in the skill, monitoring and documentation of cerebrospinal fluid, color, and intracranial pressure, require registered nurse, level of education, and scope of practice. Although repositioning patients is frequently delegated to UAP, repositioning a patient with a ventriculostomy is complex and should be supervised by the RN. Next, which information about a 30-year-old patient who is hospitalized after a traumatic brain injury requires the most rapid action by the nurse? The answer is pressure of oxygen in brain tissue is 14 millimeters of mercury. The PbTO2 should be 20 to 40. Lower levels indicate brain ischemia. An intracranial pressure of 15 is at the upper limit of normal. CSF is produced at a rate of 20 to 30 milliliters per hour, and the reason for the sinus tachycardia should be investigated. But the elevated heart rate is not as concerning as the decrease in PbTO2. Next, the nurse is caring for a patient who has a head injury and fractured right arm after being assaulted. Which assessment information requires the most rapid action by the nurse? The answer is the patient is more difficult to arouse. The change in level of consciousness is an indicator of increased intracranial pressure and suggests that the action by the nurse is needed to prevent complications. The change in blood pressure should be monitored, but it is not an indicator of a need for immediate nursing action. Headache and a slightly irregular apical pulse are not unusual in a patient after a head injury. Next, which finding for a patient who has had a head injury should the nurse report immediately to the healthcare provider? The answer is pale yellow urine output is 1200 milliliters over the last 2 hours. The high urine output indicates that diabetes insipidus may be developing, and interventions to prevent dehydration need to be rapidly implemented. The other data do not include a need for any change in therapy. Next, when admitting a 42-year-old patient with a possible brain injury after a car accident to the emergency department, the nurse obtains the following information. Which finding is most important to report to the healthcare provider? The answer is patient takes warfarin daily. Use of anticoagulants increases the risk for intracranial hemorrhage and should be immediately reported. The other information would be unusual in a patient with a head injury who just had arrived in the ED. Next, a patient being admitted with bacterial meningitis has a temperature of 102 and a severe headache. Which order for collaborative intervention should the nurse implement first? The answer is swab the nasopharyngeal mucosa for cultures. Antibiotic therapy should be instituted rapidly in bacterial meningitis, but cultures must be done before antibiotics are started. As soon as the cultures are done, the antibiotics should be started. Hypothermia therapy and acetaminophen administration are appropriate but can be started after the other actions are implemented. Next, a patient with possible viral meningitis is admitted to the nursing unit after lumbar puncture was performed in the emergency department. Which action prescribed by the healthcare provider should the nurse question? Answer is restrict oral fluids to 1,000 milliliters daily. A patient with meningitis has increased fluid needs, so oral fluids should be encouraged. The other actions are appropriate. Slight elevation of the head in bed will decrease headache without causing leakage of cerebrospinal fluid from lumbar puncture site. Antibiotics should be administered until bacterial meningitis is ruled out by cerebrospinal fluid. Next, which action will the public health nurse take to reduce the incidence of epidemic encephalitis in a community? The answer is encourage the use of effective insect repellents during mosquito season. Epidemic encephalitis is usually spread by mosquitoes and ticks. Use of insect repellent is effective in reducing risk. Encephalitis frequently requires that the patient be hospitalized in an intensive care unit during the initial stages. Antibiotic prophylaxis is not used to prevent encephalitis because most encephalitis is viral. West Nile virus is most common in adults over age 50 during the summer and early fall. Next, to assess for functional deficits, which question will the nurse ask a patient who has been admitted for treatment of a benign occipital lobe tumor? The answer is, are you experiencing visual problems? Because the occipital lobe is responsible for visual reception, the patient with a tumor in this area is likely to have problems with vision. The other questions will be better for assessing function of the temporal lobe, cerebellum, and frontal lobe.